താഴെത്തട്ടിലേക്ക് മറ്റുള്ളവർക്ക് ഇത് പകർന്നു കൊടുക്കാതെ അതിനകത്ത് ഉപയോഗം വരുന്നില്ല എന്നുള്ളതാണ്. അപ്പൊ അതുകൊണ്ട് അത് ട്രെയിനിങ് കണ്ടിന്യൂസ് ആയിട്ടുള്ള താഴെത്തട്ടിലേക്കുള്ള ട്രെയിനിങ് മാത്രമല്ല, ഇനി വരുന്ന ഡിസാസ്റ്റേഴ്സിലുള്ള ഇൻവോൾവ്മെന്റും അതിനകത്ത് ഡെഫിനറ്റ്ലി വരും. നമ്മൾ ഡെഫിനറ്റ്ലി ഈ നമ്പേഴ്സ്, ഈ ആൾക്കാരുടെ എല്ലാം ലിസ്റ്റ് നമുക്ക് ഉണ്ടാകും. അപ്പൊ ആ മെന്റൽ ഹെൽത്ത് പ്രോഗ്രാമിന്റെ ഡിസാസ്റ്റർ മാനേജ്മെന്റ് വർക്കിന് ഇവർക്ക് ഈ പങ്കെടുത്ത എല്ലാവർക്കും തന്നെ, അത് ഇവിടെ മാത്രമല്ല, നെക്സ്റ്റ് എറണാകുളം ട്രെയിനിങ്ങും കോഴിക്കോട് ട്രെയിനിങ്ങും ഒക്കെ അവർക്ക് പിന്നെ ഈ പറഞ്ഞ പോലെ ഇൻവോൾവ്മെന്റ് അതിനകത്ത് കൊണ്ടുവന്ന് നമുക്ക് മുന്നോട്ട് പോകണം. അതുപോലെ നമുക്ക് താഴെത്തട്ടിലെ ട്രെയിനിങ്ങുകളും കൊടുക്കുകയും വേണം. അപ്പൊ അത് തീർച്ചയായിട്ടും നിങ്ങളായിരിക്കും അതിനകത്ത് മാസ്റ്റർ ട്രെയിനേഴ്സ് ആയിട്ട് വരികയും ചെയ്യുക. അപ്പൊ എന്നാൽ മാത്രമേ ഇത് ശരിക്കും ഫ്രൂട്ട്ഫുൾ ആവുകയുള്ളൂ. അല്ലെങ്കിൽ നമുക്ക് ഈ 5 days ഓഫ് കോഴ്സ് ഒരുപാട് ഇൻഫർമേഷൻ കിട്ടി, ഒരുപാട് നിങ്ങൾ എൻജോയ് ചെയ്തു, ഒരുപാട് കാര്യങ്ങൾ നിങ്ങൾക്ക് സ്കിൽ ഡെവലപ്പ് ചെയ്തു ഒക്കെ ഉണ്ടെങ്കിലും നമുക്ക് താഴെത്തട്ടിൽ എത്തിക്കുമ്പോൾ മാത്രമേ നമുക്ക് അതിനകത്തൊരു സക്സസ് എന്ന് പറയുന്നത് പറയാൻ പറ്റത്തുള്ളൂ. അപ്പൊ അത് നമുക്ക് അതിനുവേണ്ടി കുറെ പ്രവർത്തനങ്ങൾ ഇനി ചെയ്യേണ്ടതുണ്ട്. അത് തീർച്ചയായിട്ടും നിംഹാൻസിന്റെയും എലിഫിന്റെയും സജീവ് സാറിന്റെ ഒക്കെ ഹെൽപ്പ് അതിനകത്ത് ഉണ്ടാവുമെന്ന് പ്രതീക്ഷിക്കുന്നു. അപ്പോൾ അത് മനസ്സിലാക്കിയാൽ തീർച്ചയായിട്ടും ഇവിടെ കൊണ്ട് തീരുന്നില്ല. നിങ്ങളുടെ റോള് തുടങ്ങിയിട്ടേ ഉള്ളൂ. നിങ്ങൾ ഓരോരുത്തരും അവരവരുടെ ജില്ലയിൽ ഇനി മാസ്റ്റർ ട്രെയിനേഴ്സ് ആയിട്ട്, ഇപ്പൊ ട്രിവാൻഡ്രം, കൊല്ലം, ആലപ്പുഴ, പത്തനംതിട്ട ഡിസ്ട്രിക്ട്സ് ആണ് ഇതിനകത്തുള്ളത്. അപ്പൊ അവിടെ വരുന്ന ട്രെയിനിങ്ങുകളിലെല്ലാം മാസ്റ്റർ ട്രെയിനേഴ്സ് ആയിട്ട് നിങ്ങളായിരിക്കും വരിക PMSD കീഴിൽ. അപ്പൊ എന്നാൽ മാത്രമേ നമുക്കത് മുന്നോട്ട് കൊണ്ടുപോയിട്ട് കാര്യം. അപ്പൊ അത് എപ്പോഴും മനസ്സിലാക്കുക, തുടങ്ങിയിട്ടേ ഉള്ളൂ എന്നുള്ളത് എപ്പോഴും മനസ്സിലാക്കുക. Thank you all, and thank you for the NIMHANS for conducting such a wonderful training. Thank you.
Hello, I am Dr. Nirmal M. I work as a psychiatrist in DMHP, Trivandrum district, Kerala. I attended the training program by NIMHANS on the topic Psychosocial care in a disaster by Dr. Sathishkumar of NIMHANS. So, while we were about to join the training program, actually we were really curious like how it's going to be. It's a 5-day program and it's about a disaster and how we deal with the disaster, the victims. So like there are many other training programs or other seminars in which there will be too much theory oriented. So if it's going to be like that, then it might be tiring. So, and also if we go to a disaster affected area, how we have to deal there. So that needs a practical knowledge, how we will get it in a seminar hall. So we were really curious and anxious how it will be. But right from the beginning, we never felt tired, we never felt bored. The training program started at 9 AM till 5 PM and we were focused throughout the training program because it was more activity oriented rather than just a Socratic method of teaching. So the participants were actively involved and the trainers were active listeners. They listened to everyone. Moreover, the participants were encouraged either to talk in their regional language, it's Malayalam, or English, whichever language they are preferring. So the participants were able to actively involve in all the activities, and it was not just activity. After each and every activity there was a message or there was a lesson which was very crucial in dealing with a disaster. And the whole training program went through a correct order, like they started with how to describe a disaster, the happenings in a disaster, what are the things you have to look for, how you have to start helping, whom you should care, the special population, and how you will deal the situation in a total manner, not just one aspect of the issue. Actually, there is a difference between knowing and learning. The things that were taught here, many of the things we already knew, but I learned them because even if I knew, I didn't learn because I was not having an experience. But here I was able to involve in the activities, I was able to learn it. So this is an effective method of training, I would say. So I recommend NIMHANS to continue these activities and train more individuals so that in a future we can deal disasters more effectively. Thank you.
Myself Ashwati, I am from Trivandrum. I'm working as a nursing officer in Government Mental Health Centre, Trivandrum. When I get the information about a training program for 5 days regarding disaster management and preparedness and management, I was very eager to know what is going to happen and what extra information that I'm going to get, or how can I get improved with this training. I have many queries in my mind, and when I came here, I was able to see many health professionals and who probably might have the same questions, and we all were a little bit reserved and selective in giving answers. But immediately after 2 hours or probably 1 hour, we all will be able to mingle with each other. It just became a friendly atmosphere. It is only because of the trainers, especially Sanjeev sir and the bus team behind him. And I think this is probably the first time, because of my lack of experience, I am getting a professional training with almost the people with the same wavelength and from the same psychiatric profession. I don't think that there are too many such training programs are going on in Kerala. I'm not sure about it. But for me, this is the first time that I'm getting such a training, professional training in Kerala with health team members, especially that of the psychiatric team members. And the training topics were really helped me a lot to sharpen my knowledge. I was just like a pencil which was very blunt when I came here. I had some knowledge which was there inside me, and I was not able to update all this information. If at all we want to update the information, then we have to read from somewhere, or we have to involve in somewhere. But that all doesn't mean that they are giving me some sharpened information. But after the training, during the training itself, I was able to sharpen myself with the help of the excellent trainers. I should really thank Sanjeev sir, Lithin sir, Anish sir and the whole team for providing us such an excellent environment for the training. And also they have given us with proper information. Then they have given us brochures, booklets, everything whichever contributed to our knowledge. And they really wanted us to implement the same to our society. So that was really appreciable. That unlike certain other programs, they just didn't tell us that okay, these are the theoretical parts and you have to follow all this. It was just like how you will implement all this in your society. So it helped us to build our confidence too. I really thankful to our authority for choosing me for this training program. Really I thank them. And the environment, overall environment was excellent. We never had any bad experience over here. All the trainers were friendly, informative, supportive, and all the other health professionals were very cooperative. We were able to enjoy a lot. At the same time, we got many information, and one of the most important thing we were able to do was the HRV analysis. HRV analysis, because of doing this with the help of health inspectors who were most probably exposed to much of the disasters, with the help of them we were able to do a miniature of HRV analysis of each district. So that was an eye-opener. Which are the particular hazards in our district and how we are going to respond to the vulnerabilities and disasters. So we also had a plan now. That is, if possible, not if possible, we will maintain this chain of communication among us and with other districts too, and we would like to implement whatever we learn from here to the local community level workers too. If they get such training, it will be very helpful for us, so that in case of a disaster we will be highly prepared enough. Thank you.
Hi, I'm Mahesh Sekar social worker, District Mental Health Program Kollam. I'm attending this preparedness for disaster management for the last 5 days. Actually, when I got this intimation to attend this program, I was a bit worried because there is a 5-day program. So actually my stress was how will be this 5 days? It will be get bored because usually in trainings for the first 1 or 2 days after that we will get tired and get bored because all trainings are like that. But however here from the day first itself the time went very speed and it is a novel experience for me because I think if the training is like this we can attend it for another 5 or 10 days because so much entertainment, knowledgeable, interactive, and more thing is that everybody can look into themselves, share their experience, and all this can related to disaster management. That is what the important part of this training because every experience or every activity, whatever it is, we can relate it to disaster management. That's helpful for us because we can relate all these to our local calamities or local disasters or whatever it is, and that will help for the preparedness at local level. That is the important part of this, another important part of this training, and the team done a wonderful job because very admirable, and hats off to them. And we all learn how to be a trainer. That is another lesson we learn from this training, and such a wonderful experience. And thank you.
My name is Meera Vijayan. I am Project Officer, DMHP, Alappuzha. Before coming here, I have attended many trainings and many relief activities from 2004 itself. When I get the notification of this training, I was quite happy because for the past 2 years I am doing PSS activities for the COVID pandemic, and when I came here, I came to know that this training is a very good program and it's well designed for the 5 days. And this training cover almost all the part of psychosocial care. Actually, we do a group therapy or individual therapy or counseling session for the victims in each disaster, but this training make me feel comfortable how to act in case of a disaster and how to deal with the people, victims in each disaster camp. And I hope this will be a great knowledge for me to handle the situation where in easy and